Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hip. It is the Ischiofemoral Impingement test. So this test is pretty recent. It came out in a paper in 2016 in which the researchers were wanting to develop a very easy way to diagnose ischiofemoral impingement syndrome without having to send off for imaging or for any kind of surgical exploration. If you're actually wondering what ischiofemoral impingement is, it's when tissue gets impinged back here in the hip. And they say this can happen with running or walking, so any kind of extension like this in the hip will cause pain. To perform this test, you have the person lying on their side, painful side up. Now I will say it doesn't give a detailed description exactly how to perform this test with some of the ins and outs, but there is a picture, so I'm just kind of going off of that. So that you support the lower part of the leg and that you take the hip into extension. And if this produces pain with extension in neutral, it's a positive. Also, if you produce pain with the hip adducted, so adduction, if that produces pain, it's a positive. And if it relieves symptoms when you abduct, so when you take it away, they feel better, okay, that's a positive as well. However, like I said, it doesn't tell you like how far, do you take it to end range, do you do it to degree, or do you keep it the knee? It doesn't say that in the paper, but that is how you perform the test. In terms of the research for this test, the original paper, they did look at a pretty small group of people. So there was like 30 people with posterior hip pain, and then they found like 17 of them met the requirement of having ischiofemoral impingement, and they did this test on it, and they did find it was a pretty good test. So the sensitivity was 82%, specificity 85%, a positive predictive value of 88, and a negative predictive value of 79. So, like I said earlier, they believe that this is a good test to utilize if you're suspecting ischiofemoral impingement, and so you don't have to worry about sending them off for imaging or, like they said, doing a surgical exploration to diagnose it. So you can just jump right into a treatment on it. So there you go. That is the ischiofemoral impingement test. Let us know what you think about it. Do you use it? Do you think we need more research on it? Let us know down in the comments below. And like always, take care of yourself. Take care of your patients. We'll see you next time.